Hello, welcome back. It's Jess and Kelly Day. Welcome, Jess. Again, as you said, what did you say? Like, we're just going to burst into a burst of giggles or something like that, right? Anyway, I'm Kelly Baltzell, Beyond Indigo CEO and owner, and this is Dr. Jess Trimble, technology extraordinaire. And it is a Wednesday, so we're giggling early because that's the way we are. So welcome, Jess. What do you have for us today?
Thank you for having me. As always, I'm going to have a hard time keeping a straight face today. Today, we are talking about artificial intelligence, which really feels like a total misnomer because there's not really anything intelligent about it yet. Maybe someday. But right now, artificial intelligence is really more just artificial learning. And so that's what we're going to talk about, I think, a little bit more deeply. So just a quick little backtrack and history. I learned today in looking this up that artificial intelligence, that term was actually coined in the 50s, which really surprised me. And actually in 69, Apollo 11's lunar module landed using like one of the first sort of artificial intelligent algorithms. So this has been happening way longer than what I thought. But it's more interesting to me if we think about that exponential curve of technology and how quickly we learn new things. Medical information has been something that, back in the 50s, we had people researching, we had doctors that were doing studies. Now we have many, many, many times the number of people doing the same amount of research, making the same discoveries, and currently, the amount of medical information doubles every 3 months. And I think we need to take a moment and actually absorb that. The amount of medical information doubles every 3 months, which means that everything I learned in veterinary school, I would need to double that multiple times over to catch back up. It's an incredible thing to try to comprehend. So obviously, there is no way that my little measly human brain can contain all of the medical information that I would really want to be a great veterinarian. And so veterinarians back in the 50s and 60s, they were diagnosed a book to look at. Now veterinarians are, did we lose something? Oh, there we go. Veterinarians are not necessarily needing to have this rote memorization of all of this information, but rather they just have to figure out how to find it and how to use it and how to be efficient in that. And efficiency is going to be that key word there. So AI, artificial intelligence, is really just a technology that is rapidly analyzing massive amounts of data according to sets of instructions that we as humans build, known as algorithms. And these are just running specific tasks. So again, there's not really anything intelligent about AI, but rather it is using human-made algos to do what we want it to do. It's very task-specific. It's not replicating human cognition. It's not replicating human creativity. It's just doing what it's told. So to sort of get past that, let's talk about what AI is actually doing, because we're all using it. Google will finish sentences in my emails. My text does the same thing with that predictive texting. So there's a lot of hype. There's a lot of distrust. There's a lot of ethical issues. If we look at these self-driving cars right now, there's people that get their picture taken on roadways, right, where they're sleeping while their car is driving. That's a bit of an ethical issue in my book right now. These are all things that we're going to have to face, especially in the medical world, as AI technology becomes more and more prevalent. So to start, where is it being used in vet med right now? There's a veterinarian at UC Davis that created an algorithm that can detect Addison's disease to 99% or greater accuracy. If you're not a veterinarian, you might not know how big of a deal this is, but Addison's is like the bane of the existence of every veterinarian. We all hate it, because it can hide and look like a million other diseases. It's very hard to diagnose. But what they did is they took blood work from 1,000 dogs. They trained a computer to catch these complex patterns using machine learning algorithms. They were also able to use it to pick up other diseases like leptospirosis. And so they are shortening the amount of time it takes to get a diagnosis. The computer is not necessarily diagnosing, but it is making these diagnoses much more efficient. It's shortening that time. It is improving these patient outcomes. And so, again, it's not necessarily intelligent. It's just making us more efficient by presenting us with information in a much faster manner than what our brains can really go through. So I had the opportunity to work on developing some algorithms for a artificially intelligent chatbot that would help with medical triage for pets. And again, it's really pretty easy to do this. You can provide these systems with textbooks to read, with medical records to read, or with decision trees that you set up. And in my case, that's what I did. I set up these very complex decision trees that the chatbot can then learn from and then have a discussion with somebody and present that information in a way that it seems like you're talking to a human. It's kind of cool. They do this with virtual assistants. I believe it's called X.AI. Her name is Amy. Basically, Amy can live in your email, and if someone emails you and says, like, hey, can we schedule a call? Amy will email them back and say, yeah, based on, Jess's schedule, there are these openings available. Would you like to book one? And Amy will actually go back and forth, just like a human, emailing back and forth and schedule things for you. So virtual assistants are pretty cool. But again, more on the veterinary side, we've got some great examples. So if you want to go to the next slide, let's talk about some of these companies. We'll start with radiology. It's a really great example because it's been around for quite a while now and is shown to be super successful. So Signal Pet and Vetology both do AI-supported diagnostics in radiology. And so this is not them sending you back saying, hey, this is a heart-based tumor. What they're doing is saying, hey, this x-ray is 88% normal, but look at this area. This is not normal. Here's what we suggest. And so it's really more decision support for the veterinarian as well as efficiency. They're not having to spend as much time second guessing themselves. It's kind of like getting a second opinion instantly. And so I believe the stats were that greater than 75% of veterinarians thought that they were significantly more efficient when using a AI support system in radiology. So with this too, feedback loops are super important because if you are suggested something and you disagree, the system needs to know that. And so you can give feedback to these systems so that they can continue to learn. And really, this is critical to all artificial intelligence, is they have to have a feedback loop in order to continue to learn more. This is especially important too if we go over to VetSpire. So VetSpire is this cool little practice management system that was made by a group of students from Stanford, and it's an artificial intelligence-based practice management system. And if you see this Deep Tag logo there in the middle, Deep Tag also came out of Stanford, and they're kind of playing together. So basically, Deep Tag is an algorithm that can read notes from a veterinarian and then predict diseases based on the symptoms that you're writing down, based on your diagnostic testing outcomes that you're writing down. And so it took 100,000 medical records from CSU, taught this machine, the algorithm, tested it against clinical notes, and then VetSpire is using some of this to then, as I'm writing my notes, it's finishing my sentences. It is suggesting treatment paths. It is recommending observations, and it's doing it with each veterinarian's personal style, which I think is very cool. So it learns from each individual veterinarian and what their preferences are. I believe there's a stat out there somewhere that says that doctors are spending like 2 to 3 hours minimum a day just doing paperwork. Stuff like this is going to make us so much more efficient. It's going to be such a change for quality of life when we don't have a stack of files to work on at the end of the day, because these systems have made us so much more efficient. Other cool ones. Sophie, I think, is really interesting. So Sophie is sitting on IBM Watson's technology interface. So you can ask her questions, and she will give you answers. So basically what they did is they trained her on thousands and thousands of questions and answers that veterinarians would typically ask. What is the dose of prednisone for a 50-kilogram dog who has Addison's? Or, what is the correct treatment protocol for a dog with a GDV? And Sophie can instantly provide you that information. So again, she's not diagnosing things, but when I'm in a clinic, I'm constantly flipping through my drug dosage book. I'm flipping through textbooks because I don't know everything there is to know about some of these certain diseases. But if I can ask a program like Sophie and she can give it to me instantly, I've just saved myself 10 minutes of rifling through Google or rifling through a book. So 91% of people said that when they used Sophie, they felt that she significantly helped them to solve problems, which I think is a very cool thing. So when we look at these companies, I think that last line there is particularly critical. These are helping us solve problems. They're not a replacement for a veterinarian. They are not a true diagnostic, but they're decision support for us. They are making us more efficient. They're going to allow us to see more patients more efficiently, and they're also going to decrease costs for us. Because if I only need to spend 5 minutes rather than 15 minutes looking at an x-ray, that's great. I've got more time to do other things, more time to spend with a pet owner and help educate and explain what's going on. So veterinarians' jobs are going to be changing. We're going to have to be better people persons, because a lot of the traditional diagnostic work, maybe we won't have to be doing quite as much of it because we'll have this back-end support from these artificially intelligent systems. So it's a lot of hype around it. It's not something that's going to be changing our life tomorrow, but I suspect over the next 5 years, we will be seeing more and more of this built in to just our everyday lives as veterinarians.
It's super fun. It's kind of mind-boggling. Actually, I was trying to think of the right word. I know I've been watching Sophie for years, as they've worked with her and things like that. And you were talking about the exponential formula for information, which is true. And they have an actual name for it for technology, but I've forgotten it. Like every 18 months, we make a huge leap.
I believe it's Murphy's Law. Is that right?
No, Murphy's Law. No. If something's going to go wrong, it will go wrong. That's Murphy's.
Yeah, see, that figures. I would say that.
Yeah, which is 2020. That's actually Murphy's Law equals 2020. But there is a name, and I'm just spacing it right this second. But it's exponential for technology, which is why you're seeing this, massive growth. Like the space shuttle had less technology than our handheld smart devices.
Yeah, I found it. Moore's Law. I knew it started with an M.
Yeah, exactly. And so then you think about it, and you're like, oh my gosh! And at some point in the Moore's Law equation, I remember somebody figured this out for whatever reason, that the amount of information we digest in a day is like a 4-foot-high stack of Sunday newspapers, like the old school Sunday newspapers, the really thick ones that used to land on your driveway when I was a kid, right? And I'm like, wow, that's a lot of information. No wonder my brain hurts. So we are going to have to make a leap at some point because we can't assimilate all that, like you said, with our brains. So, like a lot of schools are memorization, regurgitation. Well, there's too much now to do that for. So how do we think into the terms of processing instead?
Yep. Our poor little brains just can't handle the amount of data that's being thrown at us every day. And things like AI, obviously, it's going to help us with that.
Mm-hmm.
Boy, this lends to a whole nother conversation of no wonder the whole world is anxious and on edge because we just can't comprehend everything that's happening. Mm-hmm. So we'll have to rely on things like AI to just help us survive in this world.
I'm personally voting for Star Trek Technologies. You get the wand, you get the bed, you get the me, and then they go, you have this, and they push a button, you're like, you're fixed, go have lunch. I'm like, sign me up for that. That's what I want.
Right. Absolutely. And I mean, they say like science fiction really like it all comes true eventually. Like
Right.
we'll get there someday. I'm excited. I might not be around. That might be a few more years out, but who knows? Maybe.
Who knows? Like, who predicted this year, right? So
Nobody.
So who knows? Who knows? I'm all for it, though. Well, thank you, Jess.
Oh, pleasure as always.
It's one of those days.
It is.
We started laughing on the show. We're going to end laughing on the show. I can't think of anything better. It's good.
We'll see you guys later.
Bye.